calling card of the future, quoted by Anna Esho. Assalamu alaikum wa rahmatullahi wa barakatuh. May the peace and blessings of Almighty be upon all of us. Good morning, esteemed dignitaries, respected faculty members, and my dear students. It is with great pride and enthusiasm that we welcome you all to National Pharmacy Education Day, PHARMA ANVESHAN-2025. Today, as we mark the 123rd birth anniversary of Professor Mahadev Lal Shroff, the pioneer of pharmaceutical education in India, we celebrate his vision of academic excellence and innovation. The best way to predict the future is to create it. Pharma Anveshan, meaning pharma exploration, is more than just an event. It is a movement towards fostering entrepreneurship and innovation in the field of pharma and pharmacy practice. This year's theme, Entrepreneurship and Startups in Pharma and Pharmacy Practice, encouraging innovation, incubation centers, and pharmaceutical startups, reflects a commitment to empowering young minds, nurturing startups, and shaping the pharmaceutical industry of tomorrow. So to begin this event on an auspicious note, let us begin the blessings of Almighty with a prayer by Sawad from second year B.Pharm.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألف لام ميم ذلك الكتاب لا ريب فيه هدى للمتقين الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون والذين يؤمنون بما أنزل إليك وما أنزل من قبلك وبالآخرة هم يوقنون أولئك على هدى من ربهم وأولئك هم المفلحون. صدق الله. In the name of Allah, most gracious and most merciful. This is a book about which there is no doubt, a guidance for those who are conscious of Allah, who believed in the unseen, established the prayer, and spent out of what we have provided for them, and who believed in what has been revealed to you, and what was revealed before you, and hereafter they are certain. Thank you.
Head of Department of Chemistry, to deliver the preamble and welcome the gathering.
Assalamu alaikum. Good morning, everyone. It is my honor and privilege to welcome you all to PHARMA ANVESHAN 2025, an event dedicated to fostering innovation, entrepreneurship, and growth in the field of pharmacy. Today, as we gather here to celebrate National Pharmacy Education Day, we also pay tribute to a visionary leader whose contributions laid the foundation of modern pharmacy education in India, Professor Mahadev Lal Shroff, M.L. Shroff. On this special occasion, we commemorate the 123rd birth anniversary of Professor Mahadev Lal Shroff, the father of pharmacy education in India. Pharmacy Council of India decided to recognize the contribution of Professor Mahadev Lal Shroff for establishing the pharmacy education in India by declaring his birth anniversary as National Pharmacy Education Day. The first celebration of this day was done in 2023 throughout the country. To honor his contribution, PCI has coined the celebration's name Pharma Anveshan. The theme of Pharma Anveshan 2025 is entrepreneurship and startups in pharma and pharmacy practice, encouraging innovation, incubation centers, and pharmaceutical startups. It took long years for us to officially recognize his contribution. Someone once said, "It is better late than never." His life was not rosy but full of struggle. Born in the family of Saraf in Darbhanga, Bihar in 1902, he later changed surname to Sharaf. He lost parents at a very early age. He went abroad and returned to the country after successfully completing Bachelor of Arts with honors in chemistry and microbiology from Massachusetts Institute of Technology in 1927. On his return, he was jailed by the British government for his involvement in freedom struggle. After brief imprisonment, he joined Banaras Hindu University as assistant professor of organic chemistry in 1930. He was able to impress Pandit Madan Mohan Malaviya, the great nationalist founder and vice chancellor of Banaras Hindu University. On need of pharmaceutical manpower requirement, he was instrumental in starting the regular B.Pharm course from July 1937. This was the first B.Pharm course in India. That is the reason why he is appropriately called father of pharmaceutical education. Professor Sharaf has laid the strong foundation of pharmacy education. It has grown to a level of world-class pharmacy institute. Professor M.L. Sharaf held several responsible positions and worked for the progress of pharmaceutical education and profession. He was an elected member of the first Drugs Technical Advisory Board constituted under the Drugs Act in 1941 and continued for 2 terms till 1947. He became the member of the Indian Pharmacopoeia List Committee in 1944. The Indian Pharmacopoeia List was first published in 1946. The Pharmacopoeia List was the precursor of Indian Pharmacopoeia. He was a member of the Health Panel of the Planning Commission of the Government of India. He was nominated by the central government as a member of Pharmacy Council of India. The first PCI was constituted in 1949 after enactment of Pharmacy Act 1948. He was elected as first vice president of the council in the first meeting itself in 1949. He continued in this position till 1954. Later, he was elected as president of PCI and continued till 1959. He was involved in designing and operating the first education regulation. He started Indian Pharmaceutical Congress Association. Currently, IPCA organizes the Indian Pharmaceutical Congress every year. He was instrumental in forming Association of Pharmaceutical Teachers of India in 1966. In addition, he started several pharmacy magazines and journals. On the 25th August 1971, he breathed his last following a fatal cardiac attack. Even on his last day, he worked for 5 hours. His devotion to work and love for pharmacy is exemplary. Though Professor M.L. Sharaf did not have formal training as pharmacist, though his visionary understanding, he shaped both the pharmaceutical education and profession in the country. During his time, no Indian pharmacy books available and foreign books were not affordable. Realizing this pathetic situation and to help the future students and teachers, he started authoring many books. He wrote books on pharmaceutical chemistry and pharmacy comprising about 6,000 pages. He authored 23 textbooks. His legacy reminds us that pharmacy is not just about medicine, it is about innovation, leadership, and service to society. Today, through Pharma Anveshan 2025, we continue his mission by encouraging young minds to explore startups, research, and cutting-edge advancements in pharmaceuticals. His vision was not just limited to education, but also aimed at bridging academia, industry, and healthcare, ensuring that pharmacists play a crucial role in drug discovery, manufacturing, and patient care. His contributions continue to shape the pharmacy profession, and it is our duty to carry forward his mission by embracing innovation and scientific advancements. With this, first and foremost, we are deeply honored to welcome our chief guest, Mr. Asim Shayes Shiraz, CEO of Yanapoya Technology Incubator. This occasion with his presence. Sir, your expertise in fostering innovation, incubation, and technology-driven startups is an inspiration for budding entrepreneurs in the pharmaceutical domain. Your presence here adds immense value to this event. We eagerly look forward to your insights and guidance. Welcome you, sir.
I request Principal Dr. Salimullah Khan to welcome the guest with a sapling.
A special welcome to Dr. Syed Amin, Dean of Student Affairs, whose active involvement, dedication, and encouragement have greatly contributed to the success of events on the PACE campus. Welcome you, sir. We also acknowledge the valuable support of Mr. Harris TD, whose contributions add strength to our initiatives. I heartily welcome Mr. Harris TD, Purchase Director PAET, to this program. We are also honored to be under the patronage of Mr. Abdullah Ibrahim, Managing Trustee PAET, whose leadership has always been instrumental in promoting education and research. Now I express my sincere welcome to our dynamic principal, Dr. Salimullah Khan, who is presiding over this event today. He is the guiding force behind such initiatives. His vision and leadership continue to elevate the college to greater heights. Welcome you, sir. He is also the member of PCI Pharmacy Council of India and also BOS Board of Studies Chairman of RGHS. Welcome you, sir. I heartily welcome all HODs, my dear colleagues, dear students, and teaching and non-teaching staffs and media person to this program. I once again extend a warm welcome to each one of you to this wonderful program, Pharma Anveshan 2025. Let us make this event a memorable and impactful one. Thank you one and all.
Wonderfully sharing the life and contribution of EML Shroff in pharmaceutical field, and I take the privilege to welcome you two for this program. As we pay homage to Professor M.L. Shroff, the father of pharmacy education in India, let us inaugurate this event by unveiling the photo. I request our chief guests and dignitaries on the dais to do the honors. Let this serve as a reminder of his legacy and a collective responsibility to carry it forward.
M.L. Shroff is regarded as the father of Indian pharmacy education and played a crucial role in shaping the pharmaceutical landscape in India. Today we honor the legendary Professor M.L. Shroff, visionary leader who laid the foundation of modern pharmacy education in India. As a key architect of the Pharmacy Act of 1948, he played a pivotal role in establishing structured pharmaceutical education and regulation in the country. His contributions to the development of pharmacy as a profession in India are unparalleled, and his unwavering efforts led to the introduction of B.Pharm courses at Banaras Hindu University in 1937, making a new era in pharmaceutical sciences. His vision continues to inspire generations of pharmacists and academicians. As we unveil his photo, we pay tribute to his immense legacy in the field of pharmacy.
Thank you, sir. The role of an entrepreneur is to find an idea and turn it into innovation. We are privileged to have with us Mr. Asim Sayyed Shiraz, CEO of Enopoya Foundation for Technology Incubation, as the chief guest today. Mr. Shiraz brings over a decade of experience in entrepreneurship development and mentoring, rapid prototyping, product development, and innovation management. He serves as a mentor and advisor to various startups and was a founding CEO of MedTel Healthcare Private Limited. He holds a master's degree in biomedical engineering from University of Dundee, UK, and bachelor's degree in medical electronics engineering. His passion for innovation and entrepreneurship is evident through various certificate programs, including Blue Certificate for Innovation and Entrepreneurship by Scottish Institute of Enterprise UK, Incubator Manager Training by IC2 Institute UT Austin and Startup Nexus, Certificate course on Healthcare Innovation and Entrepreneurship by Duke University USA, and training on IPR organized by IISc, to name a few. Sir, we are honored to have you with us today. Let us extend a warm welcome to Mr. Asim Sayyed Shiraz. I now invite him to enlighten us with his words of wisdom. Over to you, sir.
It's my honor and privilege to be here today, and I would like to thank the principal for extending me the invitation. And I'm very happy to see a lot of young crowd here who are going to graduate very soon, and then who are going to enter the world of, let's say, as a professionals in pharmaceutical world, right? So you have a lot of things. So by choosing pharmacy education, you have chosen to have a commitment towards betterment of mankind, right? So if you look at pharmacy, it's a very noble profession. Whatever you do, no matter let's say you end up in R&D, you go to even, let's say, sales or whatever function you enter, you go to industry, academia, doesn't matter where you go, you have a common goal, right? So you're all trying to do good for the mankind, right? So that's what it is. So if you just think of it, and then whatever you do, whatever actions you do, if you think that you are doing it all for betterment of mankind, I'm sure that you are going to do wonders. You are going to do great. Okay. So specifically, let's say I'll come to the topic. The theme of today is let's say promoting. It's rightly so. Once you have the foundation of education, research, then comes the innovation, entrepreneurship, etc. Right. So it's always to have good to have a very good solid foundation. So I'm sure, let's say, as you have chosen your courses, you'll be studying a lot of things about, let's say, all the different fundamentals. Like when you look at the research also component as well, you have to be very sure that what is that you are going to do, let's say, different, right? So you can't be just doing research for the sake of research. So I'm just talking about, let's say, the basis for innovation, right? So what do you mean by research? What do you do in research? Generally, anyone? What do you do in research? Why do you do research? You find something new, or you try to solve a problem. You try to do something better, right? So that is what you are trying to do. So when you look at research and innovation, they are not very different. Innovation is also, you are trying to do something new. You're trying to find something new, right? And then when you talk about entrepreneurship, so you might have heard, so these days it's very common to talk about entrepreneurship. It was not so, let's say, common earlier. These days, a lot of people know what is a startup, right? So especially like let's say if you talk about maybe IT industry, so once upon a time, which is just 10 years ago maybe, nobody wanted to take up a job in a startup. The moment the companies had to mask, when they go for recruitment, they have to mask that they're a startup. They have to pretend to be a MNC, or they have to pretend to be a larger company. But these days, the trend has changed completely. All the students would want to definitely at least have one internship in a startup or have a job in a startup. Then it's not very different in pharmacy as well, because there are a lot of pharma companies, there are a lot of pharma startups. Thanks to like a lot of government of India initiatives such as BIRAC, which started in 2012, so which is being like promoting a lot of innovation and entrepreneurship in pharma, healthcare, biotech, medtech, all these allied areas, right? So it's very important for you to really understand what is that you are going to do better, let's say with respect to innovation or a startup or entrepreneurship. So I would like to link it in a very simple terms. In research, what you would do is you would try to look at a most difficult problem and you will try to solve. Probably you want to come up with a formulation which is easily, like let's say dispersible, or you want to do something, let's say change one form of delivery to another form of delivery. Maybe you want to go for targeted drug delivery. You have a lot of options, right? So you don't have to really necessarily do something which is groundbreaking always, right? So there are two types of innovations, or like let's say in terms of research, right? You can do something incremental or you can do something exponential. So it is always like let's say you don't have to always do something out of the blue, right? Out of the box. Just having common sense to like let's say maybe make a problem, solve a problem, simple problem, right? So that is good enough. Maybe repurposing of a drug, like let's say there is a drug which is available for certain indication which is approved. Maybe you have a for like orphan disease, right? So for orphan disease, like you all know what is orphan disease, right? Lot of innovations, like let's say a lot of formulations and a lot of products which are coming out of a lot of larger companies, they are only the ones which are sure to make them very highly profitable. Let's say maybe 20 times the profit of what they like not 20, maybe 200 times of what they spend on R&D, right? So that is how the scale is in larger companies. Something which is smaller, which won't fetch them a lot of profit, they would not be working on it, right? So probably you can take up something like that. So even if you repurpose a drug, let's say for orphan indication, or maybe come up with some new formulation and all, so all these smaller things itself are substantial. So you can do research, understanding that you are trying to do something good. So when it comes to innovation, innovation and entrepreneurship are closely linked. So what you try to do is you not only do like let's say research in finding something new, you also try to ensure that it goes to the end users, right? So maybe it gets manufactured as a drug and it goes to the like let's say caregivers or the patients. That's what you try to do, something extra, okay? So I just want to tell you that innovation and entrepreneurship is something not out of the box, not something which nobody knows. Everyone of us know what is innovation and entrepreneurship. But if you, like let's say, as I told in the beginning, if you think of your whatever you're trying to do, it's for betterment of mankind. If you think of that, and then if you try to see that, how do I solve this problem? Not only stop there in solving the problem, ensure that it is translatable. Ensure that it goes to the market, it goes to the right intended users, right? If you intend to, like let's say, if you do that with a purpose, so that is your innovation. Entrepreneurship is actually taking it, right? So in terms of like, let's say, I would just like to take a step back and tell you, do you know what is technology readiness level? Have you heard of technology readiness level? It's a really good thing for all of us to know what is technology readiness level, okay? So I keep telling this everywhere. So the basic, so the concept came from NASA. So if you, I don't know, if you read news, one fine day you will see that you got photos from Neptune or some distant star and all, right? So those photos are coming, if you read a little bit more detail, the satellite or the mission would have been initiated maybe 20 years ago, 30 years ago, right? So you can understand, if you have to do such a thing, you probably need 20 years of planning, 30 years of planning, you need technology, you need a lot of things to come up, right? So that's where they released a concept called technology readiness level, which would put all of their technologies at a different scale. We start at TRL1, Technology Readiness Level 1, and we go till 9. So generally, like let's say it is classified as 3 categories: research, development, and deployment. That's what we call as. Okay, so there are total 9. We divide them in 3, 3, 3. Okay, so if you understand in pharmaceutical, like let's say domain, there are a lot of things for drugs. There are, like let's say, different because what you do for, let's say, biosimilars is different. What you do for just like IND is a different in investigational new drug. And if it's a new drug, it is different. Vaccine, it is different. Biotherapeutics, it's different, right? So there are a lot of domains. Everything has a different path for you to move forward. So Government of India has now, like let's say, adopted the TRL levels, which was popularized by NASA in 1970s. And especially if you go to BIRAC website, if you search BIRAC, BIRAC, TRL, and you will get a page with different TRL levels for different areas, as I said. Why is it important? So it actually, like let's say, if you want to go from education, research, then innovation and entrepreneurship, this is very important. Okay. So if you understand, like let's say, maybe in this particular event, what do we have? We have few people who are on the dais, right? So there are presenters and there are like the audience, right? So everyone has a role. Can we just do this particular event only with presenters, only with dais, like people on the dais? No, we need everybody, right? So similarly, TRL levels are very, very important for you to understand what role you are going to play, right? Either are you coming at research level, development, or deployment. Okay, so if you understand there, like let's say, if you do as per this framework of TRL levels, you will understand that if you, like let's say, if as a third party I come and look at your research, I know that you have followed a framework and I know what you have done. If you say you have done TRL level 3, then I know that you have done in vitro studies, right? So next, if you want, I can come and take your technology and then I can do TRL level 4, 5, and somebody else can do TRL 7, 8 and all, okay? So this is to just tell you and then like inform you about that everything is interconnected, your education and then research, innovation, entrepreneurship, everything is there. And there are a lot of like opportunities for you to right now concentrate on like maybe like you want to go into directly into startup, you want to have your companies, it's very easy. There are a lot of funding schemes which are available by different government bodies, state government, central government, there are a lot of bodies. So just to name a few, there is something called as MSME Idea Hackathon, which is a series wherein they give around 15 lakh rupees for students. If you are a student, doesn't matter which student you are, whether you are an undergraduate, postgraduate, doctoral student, doesn't matter. Everyone gets 15 lakh rupees to prototype their idea. And yeah, of course, like whatever I'm talking is relevant to you. It's for overall healthcare as a domain, right? It could be pharmaceutical, it could be medical device or whatever it could be. So you can even, like let's say, while you're studying, come up with your, if you have come up with your idea, you can approach like your institute as well would have it. And anyway, I'm happy to help you as well if you need any guidance. So you can apply for starting from 15 lakh rupees as a student. So if you like ask others, it was very difficult earlier. As a student, your voice is not heard at all, right? So basically you're not encouraged, not now, I'm telling like maybe a few, a decade ago maybe, so there was no opportunity. Now you can think of an idea, start like let's say you get your funding, let's say 15 lakh rupees. If there are some other schemes by state government, central government, wherein you can, after finishing your, let's say, bachelor's degree or master's degree, you can, for 1 year, they will give you monthly fellowship. Okay, so the fellowship can start as low as 30,000 rupees to something like maybe even as a bachelor's, you can even get easily 60,000 rupees monthly fellowship. It could be for 1 year to 1.5 years. Only for you to pursue your ideas, okay? Only for you to, like even we had one graduate with us, like from pharmacy, who joined something called a social innovation program. So he entered, like let's say, with empty hands. He had no idea. So with that scheme, he went and observed different areas, like let's say it was on maternal and child health, right? So he went to different clinics, he went to doctors, he tried to identify the problem, and then he found out the biggest problem is over prescription of antibiotics, right, for pediatric cases in diarrhea, right? It's very common to have diarrhea, right? But most of the times we don't know what is the cause. As parents, we are concerned. Doctors are also under pressure to prescribe antibiotics. But when do you prescribe antibiotics? You do it only when? If it is a bacterial infection. You don't do it for viral infection. But do you know what is the prevalence of bacterial versus viral? So it would be almost equal, okay? Or in some cases, it would be probably, some regions it would be more viral than bacterial, right? So unnecessary antibiotics are being prescribed for kids or infants, maybe even toddlers who are of 1 year age or 2 years of age and all, right? So that he developed a test, simple test with this concept that he wants to identify, he found a biomarker, he would take a sample from the poop and then measure, like let's say from whether it's bacterial infection or diarrheal. If it is bacterial, you prescribe. So this is just a 15 minutes. When you go to a doctor, you collect a sample, fecal sample. Fecal sample will tell you whether to prescribe or not. So this is something very simple. So he just tried to solve a simple problem. So I'm just encouraging you to think of problems around you and the education support which you have got. If you have not learned something, it's high time to learn. Of course, not everyone can be expert in every area. So you can choose a problem and then try to develop your expertise around it. Okay. And just last thing what I would like to tell you is, which is compulsory to talk about, AI is something which is coming up everywhere, right? So if you look at AI, maybe just 1 year ago to now, it's very, very advanced. So please don't use it for your, like let's say, cheating or writing your assignments, but try to use it for the good. So there are, like let's say, with genomics, with multiomics and all, we used to generate a lot of data. Now it's very easy with AI to do drug discovery, right? So I don't know whether you heard in the news that somebody, like let's say, came up with using AI a new drug target and a new molecule which can, like let's say, solve a particular disease, right? So there are a lot of things which are going to happen. You may have to, depending on what area you choose, if you are going to drug discovery or whatever, like I'm sure that AI is going to touch every area. Please be sure that you are updated with the latest trends. Don't think that it's only for software developers or coders and all, right? So you should think of more of an interdisciplinary approach. So probably you heard in my introduction, I'm not from pharmacy, I don't have any background, but I keenly work with everybody. Okay, so I interact with a lot of like people. So I'm very proud to probably tell you, just to probably inspire you, that I as a PI could get a grant of 10 crore rupees from Government of India to translate, not for pay. It is for not for my work. My role is just a simple thing. Identify academic research which has high potential for translation and translate it to to industry, like let's say transfer it to industry by doing clinical trials. So we do have clean room facilities and all. So we have identified 5 projects. 2 projects what we are supporting are from Tata Memorial, wherein BARC, which is for like under radiation, Ministry of Radiation. So they have developed a drug for radiation-induced pneumonitis. If you give this oral drug, it will stop the lungs from getting any, like let's say, radiation-induced damage, pneumonitis, for any, like let's say, radiation which you give for either breast cancer or for various other lung cancer and all, right? So this is there, it was lying for like 10, 15 years, right? So basically it's not that I'm proud to say that I've got it, but I've got a target on my back. So funding agency keeps on asking me, what is the status of this project? Has it been manufactured? Have you got a test license from CDSCO? Have you got a clinical trial license, CT4, CT5 and all? So have you done your clinical trials? So that is what I'm doing. So what I mean to say is, it's not very, very difficult. Don't think that you are limited by your education or limited by what you study, where you study. So I'm sure that if you are having, as I said again, I repeat, If you have that vision that you want to do something good for mankind, I'm sure you are going to come up with something great. That's all. With this, I would like to stop and thank everyone to give me opportunity.
And motivating a students to its innovation and entrepreneurship, and highlighting about the need of an hour, that is AI. And your talk just reminded me of a quote: dream big, start small, but most of all, start somewhere. So, and you are truly an inspiration to all of us, and I'm sure we all will take this and start somewhere with something. Gratitude is not only the greatest of virtues, but the parent for all others. As a token of appreciation and gratitude, we would like to felicitate our esteemed chief guest, Mr. Asim Sayyed Shiras, CEO of Enopoya Foundation for Technology Incubation, for gracing this occasion with his presence and insights. I request the dignitaries on the dais to do the honors.
Opportunity, we have to look into opportunity, then according to the opportunity we have to put our efforts. From your pharma point of view, what are the opportunities? One example is about COVID. You remember COVID, Corona? Okay. How was that period? Full enjoyment, right? No classes, nothing, right? Okay. But who was the richest people or who encashed COVID? Yes, medical and pharma people. And if you see, the people who were crorepati's were from the pharma, okay, correct? Who invented the vaccine, were one of the richest, and they took villas in some islands. Okay, clear? It was the opportunity. It was the opportunity. Dear students, like this, you will have opportunities, and opportunities will come from your research about opportunity. You have to do research that what are the opportunities in front of us, which are the diseases which is not having proper medicines. Clear? Second thing, from the opportunity, it is not that it should be fresh. Okay? It can be value addition. Clear? Simple example, can diabetic people whether they can have Horlicks? No. What is your view as pharma people? No? Yes or no? Yes or no? Okay. HUL, who is producing or who is marketing pharma, this Horlicks, they launched Horlicks for diabetics. Horlicks for diabetics. Clear? Horlicks was in market. But if you see now, unfortunately, the India is like a hub of diabetic. Clear? If you see, if young people also, if you ask them, they will prefer, okay, sugarless tea, correct? Sugarless juice, okay? This is the trend, and it is this proportion is increasing day by day. So if you see the products which is available, food products, starting from biscuits and all other items, every companies, every food manufacturing started to launch sugar-free items in their products. Clear? Recently when Horlicks understood market, so this is like, it is not that a problem should be new. It can be a product which is already available in the market, but you have to think from the existing problem point of view. Clear? If that is the case, that is why Horlicks, if you see Horlicks, they have done the research. Okay, the research was from the point of view of health, where they launched Horlicks for diabetics. What they did, they ensured that after having Horlicks for diabetics, sugar level will not increase. Clear? It is not, as Asim sir was saying, it is not that 1 day effort or 2 day efforts. Okay, for example, if you want to bring up a vaccine for the problem which is not solved, the disease which is not solved for a long period, there will be research which may be going on from last 20 years or 30 years. One day they will come up with the result, and they will get the result, and they will launch it to the market. Similar way, existing things which is there already in the market, and the problems which are coming up or which are there in market, you can attach and you can modify it. It is like existing product, you have to modify. It is also business activity. It is also entrepreneurial activity. So one change in Horlicks, they relaunched and they approached all the doctors who is treating diabetic patients, and they ensure that doctor will recommend it. Now doctors, they started recommending people that you can have Horlicks, which Horlicks? Horlicks for diabetics. Second thing is, like in business, again, for example, what is the generic name of tablets for fever? Paracetamol, correct? Now can you tell me which are the brands of tablets? Dolo? How many brands? Several brands, correct? Again, every diseases will have one generic name, okay? But fever, if you take headache, cold, you will have multiple brands of tablets. But few tablets are having only limited brands of tablet. That is again one more opportunity in front of you. We have two concepts in business. One is premium brand. Premium brand. For example, car I will take. Which are the premium brands in car? Benz, Audi, then? Okay, which are the general brands? Maruti? Okay, now tell me which are the premium tablets? Which are the premium segment? Or it may be vaccine, or it may be vaccine. Premium. Insulin. Which insulin? Sometimes we get social related messages, fundraising thing, right? One patient need one injection, cost is 18 crores. Correct? 18 crores. Clear? Imagine if they sell 2 to 3 injections. For them, that is more than enough. But to invent that injection, they might have spent crores of rupees and long duration in R&D. It's a premium segment. So decide which segment you want to take up. Whether you want to go with the premium segment, but you need to put your best. Second thing is general segment. You invent any general medicine or modify any general medicine. Modify general medicine in the sense there may be a medicine which may be costly. You can come up with some innovations or modifications which you can do it in less cost and you can launch to the market. Launching to the market also. Again, here you can take the support of technology. Earlier, medicine availability, for example, how it was? Concept of medicals, right? It was a physical store, correct? Now, online, correct? Now, tablets we buy from online stores. Clear? Again, availability, ensuring availability. Today we can ensure that tablet from Delhi will reach in one day. We have logistic developments. Clear? Earlier it was very difficult to get tablet from Bangalore city or from Bangalore within 1 day or 2 days. But today, if a doctor wants to get a tablet from a far place, maybe from foreign countries, they can ensure that that tablet will reach in 1 day. So that type of marketing or logistic advancement is also done. That is also one of the field of your business. Clear? It is not just innovation point of view, it is execution point of view. From business point of view also you have an opportunity. So my dear students, message is simple for this particular day. You are studying a pharma related things. Now, because I know when I used to go for career counseling to PUC students, when they, even I've taken once, I remember, to one pharma batch also. Then I had asked few people that what is your target? 90% people target was to sit in medical shop. Okay? To medical shop as a salesperson, correct? So I used to tell them, I have one of my neighbor who is of 10th standard, who works in medical shop, and he knows each and every tablet's name because of the experience. Okay, clear? You are meant for more. You are in a field where R&D should be your target. Okay, research should be your target. R&D, advancement, research and development should be your target, and your target should be, innovating something new from the research and executing your, knowledge and transforming your knowledge to business. So, this is the message of the day, and I'm sure that our student will, ensure that they will innovate, they will be in research, and they will ensure that the ideas which they have, it may be individual idea or team idea, will be transformed to business one day. Thank you.
Thank you, sir, for highlighting on the keyword opportunity. Your talk has directly or indirectly made us feel proud to be in the pharmacy profession, as our profession opens up a lot of opportunity even towards research, innovation and business, ultimately leading to the betterment of mankind. A great author, John C. Maxwell, quoted, "A leader is the one who knows the way, goes the way and shows the way." Foundation of any great institution lies in its leadership. We are privileged to be guided by a visionary leader who continues to inspire and drive excellence. I now invite Dr. Salimullah Khan, Principal, PA College of Pharmacy, to deliver the presidential address.
Assalamu alaikum. The chief guest of the day, Mr. Asim, Dr. Syed Amin, Mr. Haris Tedi, my colleagues, my dear students, a very warm good morning to all of you. you heard very important aspects of today's program, and I'm sure you must have taken many ideas, many cues from the previous talks, which were excellent. I'm thankful to Mr. Asim, who readily agreed on a very short notice to be a part of this program. I couldn't think a better person for this program with this theme than Mr. Asim. Thank you very much, sir. And he pointed out many things, of which the research in pharmacy, wherever pharmacy institutions are there, as a part of multidisciplinary campuses, wherever you go and see, mostly the top research comes from pharmacy. It is true with Yanopaya also. The highest number of publications and better research happens in pharmacy, because pharmacy is a multidisciplinary subject in itself. Dr. Amin was very beautifully explaining you about various products. He told you there are different brands, and basically what he was trying to tell you is to find the gaps. Even Mr. Asim told, find the gaps. When you are doing research, just not this, very nicely said Mr. Asim, that research is not done for the sake of doing. Generally what happens, we do research for the sake of publications. Okay, we will not get promoted for if we don't get the publications. We will not get good salary if we don't do the publications. There is one saying which is recently it is made. Earlier it actually two parts of the saying. Publish and grow. Okay, if you want to grow in your career, you have to publish. And there is one more aspect, publish or perish. Publish or perish. Sorry, that was earlier. Publish or perish. If you publish, good. If you don't publish, you will perish. You know everyone you know the meaning of perish. And later it became publish and perish. Earlier it was publish or perish. Later it became publish and perish. In the sense, there are different aspects of the research that you can publish after doing the research, but there are certain aspects of the research that you do not want to publish. You want to instead patent it. You want to instead go for a copyright. Right? So you have to find a proper gap. So I was saying about finding out a simple test for identifying the kind of diarrhea, whether it is viral, bacterial, or because of some GI disturbance. Likewise, research need not be all the time big drug discovery. But big drug discovery is another big headache. If I get a time, I can tell you, drug discovery is not an easy task at all. It takes 15 to 20 years and with millions of dollars. Okay, recently one of speaker in a conference recently, he was we were interacting, so he was into social research of the feasibility studies for the product launch. Okay, so one of the company had developed one product, and as Amin sir was saying, premium. So each tablet he is just immediately after R&D he has developed a product uh, which cost around 20,000 rupees. And immediately I told, in Indian setup, is it really feasible? Then they said that is what he also suggested to the company, that it is totally not feasible for the Indian market. So there is so much market research and all. So I was telling you, drug discovery is a very big program. Okay, 20 years, 30 years, okay, and millions of dollars. And if you start with a library of compounds, say around lakhs together compounds, out of which you may get only about 100 or 150 hits, okay, and out of which you may get 10 to 15 leads, and those leads, if you start, you may end up getting one product, or you may not able to get one product also. And one product, even if you're getting at the end in the phase 2, phase 3 clinical trial, it may go completely. So millions of dollars are gone. So research need not be all the time very big. Research can be even in a small quantity, as sir say, that only finding a test, right? Finding a test. There are many gaps that you can find out by the experience, by learning. So the major thing what is required is learning. You should keep learning. You should keep reading. You should keep reading the newspaper. You should keep reading the magazine. You should see what is happening around you. So what technology you can better, what system you can better by simple. If you go, most of you keep traveling in the trains. You can see in the trains there are so many simple innovations. Okay, for closing the door, this you need not have electricity. Many simple innovations are there. So innovation need not be all the time big. Innovation is anything. Even if you can reduce the manufacturing time of a tablet which is already existing by 5 minutes, that is an innovation. Just 5 minutes, not more than that, if you can reduce. Okay, so innovation is something which is very fruit bearing. Okay, and you must always keep thinking about that, and pharmacy is this one. And finally, I would like to tell you about Pharmacy Council of India, which actually started this program. We are very proud that this program is started to pay the tribute, to a rich tribute to such a great personality called M.L. Shroff, we generally call Mahadev Lal Shroff. And his contribution to, we are all here because of his contribution, his thoughts, and the Pharmacy Act 1948, which was introduced. And the Pharmacy Council is, because of this act, Pharmacy Act 1948. And Pharmacy Council has grown a lot, to a large extent. The previous presidents have done a lot of things, contributed to the development of Pharmacy Council of India. The present president has got a lot of visions, and he actually, as the pharmacy came out of AICT, the GPAT scholarships were totally stopped for the pharmacy students, postgraduate students, and this president took up that challenge, and it is not easy challenge to pay the students all over India. Okay, even if it is paid 12,000 or something, 12,600, but it is not a small money paying all over India. So focus the president is having, and he has taken it up. And then he just to improve the quality of education is very, very important. Quality of the students is very, very important. To improve the quality of the student, he has introduced the exit examination, which is going to come shortly, and also to improve the transparency. Like we have 25 teaching staff, and we show 31 teaching staff. So Aadhaar based equipment he has prescribed. Now there cannot be any kind of cheating. You are putting, we are in soup actually. So, so there are many steps which is being introduced for bringing transparency in the pharmacy education, because Pharmacy Council is a regulator of pharmacy education. So the Pharmacy Council's this act of introducing Pharma Anveshan is really remarkable. So our gratitude to the Pharmacy Council of India, and also the organizing team of this particular program today has put lot of efforts to do this program on a very short notice. So I'm thankful to all of them. Thank you, one and all.
Motivating us to do more like you always do. Not what you have, but who you become. That is the greatest motivator. And today we honor the academic rank holders in Rajiv Gandhi University for their dedication and perseverance. So we now begin with the prize distribution ceremony. As I call the name, I request the students to come and collect the certificate. I request our chief guest, Mr. Asim Sayyid Shiras, to hand over the certificate to the rank holders. First up, we have Roshan Putige, who has secured 77.3% in pharmaceutical analysis, pharmaceutics, 80.6% in pharmaceutical inorganic chemistry, and 8th rank in human anatomy and physiology 2, 9th rank in pathophysiology, 9th rank in pharmaceutical organic chemistry 3, and 8th rank in quality assurance. Next, Kritika CV, who has secured 5th rank in pharmacognosy and phytochemistry 2, 9th rank in herbal drug and technology, 10th rank in industrial pharmacy 2. Next, Mariamat Nazmia K, who has secured 7th in chemistry 3 and 7th rank in biopharmaceutics and pharmacokinetics. Next, Fatima, who has secured national chemistry 3, 10th rank in social pharmacy and 5th rank in computer aided drug design. Next, we have Tamiza EK, who has secured 867% in human anatomy and physiology 1, 9th rank in pharmacology 3, 9th rank in computer aided drug design, and 3rd rank in pharmacovigilance. Who has secured 76.67% in pharmaceutics and 10th rank in medicinal chemistry 3. Next, we have Fatima Aprina, who has secured 6th rank in pharmacy practice. Next, we have Sahida, who has secured 78.67% in pharmaceutical inorganic chemistry and 8th rank in industrial pharmacy too. Next, we have Mufida Suhaila, who has secured 9th rank in novel drug and delivery system and 6th rank in cosmetic science. Now I request our principal, Dr. Salimullah Khan, to hand over the certificates. We have Fatimat Ashrina Shireen, who has secured 2nd rank in computer-aided drug design. Next, we have Fatimat Shala, who has secured 80% in human anatomy and physiology. Next, we have Mariamat Famnaz Abdul Bashir, 76.67% in pharmaceutical analysis and 5th rank in computer-aided drug design. Thank you, sir. Now I request Dr. Syed Amin to hand over the certificates. We have Pawan, who has secured 7th rank in quality assurance, 6th rank in experimental pharmacology. And lastly, we have With that, we conclude the prize distribution. Proud of all the students who have received the certificates and for recognizing PA College of Pharmacy as the rank holders in Rajiv Gandhi University. Feeling gratitude and not expressing it is like wrapping a present and not giving it. As we are near the conclusion for this remarkable event, it is time to extend a heartfelt gratitude. I now invite Ms. Shravya, Assistant Professor, Department of Pharmaceutics, to deliver the vote of thanks.
Good morning, everyone. I am truly honored to stand before you as we conclude the event of National Pharmacy 2025 with the theme of entrepreneurship and startups in the pharma and the pharmacy practice. This event has been a remarkable journey of learning, innovation, and collaboration. First and foremost, I would like to express my sincere gratitude to our Managing Trustee, Mr. Abdullah Ibrahim, for his unwavering support and guidance in successful execution of this event. I would also like to extend my heartfelt gratitude to our esteemed chief guest, Mr. Syed Shiraz sir, CEO of Enopoya Technology Incubator, for taking time out of his busy schedule to join us to this event. Your knowledge is a testament to the power and entrepreneurship in driving meaningful change in the healthcare. Throughout this event, we have explored the exciting opportunities that lie within the pharmaceutical and the pharmacy sectors for the entrepreneurs. As we have seen today, the potential for the startups in these fields is boundless, ranging from the new drug discovery to cutting-edge technology in the healthcare solutions. Sir, your presence and insights have truly elevated this event, inspire us all. Thank you, sir. A special note of gratitude to Mr. Sharfuddin PK, AGM Campus, PAET, in his absentia, for his support and encouragement. We sincerely thank Dr. Syed Amin, Dean of Student Affairs and Director of CMSR, for his invaluable contributions and being part of this integral part of this event. Thank you, sir. I would also like to express my gratitude to Mr. Harry Steely, Purchase Director, PAAT, for his continuous support in ensuring the success of this event. A heartfelt thank you for our dynamic principal, Dr. Salimullah Khan, for initiating and encouraging us to organize this event with passion and dedication. Your leadership and guidance have been invaluable in shaping the success of Pharma Invention 2025. Thank you, sir. I extend my sincere appreciation to Dr. Mohammad Mubin, HOD of Pharmaceutical Chemistry Department, for his valuable guidance and unwavering support throughout this session. I would also like to thank the site officers for making the necessary arrangement and also the members of the media for being here today. Lastly, I would like to express my deep gratitude to all the HODs, teaching and the non-teaching staff, as well as the students of the PACP for all the support to ensure the smooth execution of this event. Thank you all and have a wonderful day.
Rise for the national anthem as we conclude today's event on a patriotic note.
पंजाब सिंधु गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभाशिष मागे गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता।